Good morning, all of you. At the onset, I congratulate King George Medical University for organizing such a wonderful IQAC conference. I am very thankful to Honorable Vice Chancellor Dr. Sonia Niyananda Ma'am, Honorable Pro Vice Chancellor Professor Abjit Kaur Ma'am, Dean Professor Amita Jain Ma'am, Organizing Chairman Professor Apul Goyal Sir, and my former colleague Dr. Ridham Ma'am for giving me this opportunity to speak on such a innovative topic and neglected topic in a curriculum. Thank you very much for giving me opportunity. So currently I am working as a controller of examination at Maharashtra University of Health Sciences, Nashik. Our university is one of the largest university of health sciences in India. Under us, more than 600 colleges, including all the faculties like medical, dental, Ayurveda, homeopathy, nursing. So, at a single time, though it is summer exam or inter exam, we conduct almost 1 lakh student examination at summer as well as winter session. And my topic is need to focus on assessment process, a key step to enhance quality outcomes. My friend, this word is very important, that is curriculum. So curriculum, by definition, is a design learning experience which include learning and assessment which facilitate the learner to achieve the prescribed outcome of a course. Many times, syllabus and curriculum, these words are used synonymously, but it's not true. Syllabus is one of the parameters of the curriculum. Curriculum is a broad concept and it consists of statement of goals. Now it is called as a competencies, course content, that is the syllabus. I already said syllabus is one of the part of the curriculum. Then teaching learning methods, organizing and scheduling course, that is the preparation of the timetable, then assessment of the outcome and the feedback from all stakeholders. So the fifth parameter, that is the assessment parameter, is very important parameter. And on this, I'm going to speak for next 25 minutes. So what is assessment? Assessment is assess. It's a Latin word. The aside means to sit with. So it's a Latin word and its meaning is to sit with. So assessment is sit with the learner, sit with the student, and something we do with and for the student and not to the students. Very important according to the Green. So assessment is a systematic process of determining the extent to which the students have achieved desired level of all the domains. What are the 3 domains? That is the knowledge, means the cognitive domain, skill is the psychomotor domain, and attitude is the affective domain. Again, I repeat, assessment is a systematic process of determining the extent to which the students have achieved the desired level of all the domains, that is the cognitive, psychomotor, and the affective domain. Also, assessment is the process by which information used by the teacher to adjust their teaching learning method and the student to adjust their learning strategies. The process of gathering data to better understand the strength and the weakness of the student learning is also the assessment. So these are the 2-3 definitions of the assessment, and it's by the Harris. So we also use, like already I told, that we use interchangeably the word syllabus and curriculum, but they are not same. Like that, we also use assessment and evaluation. But again, assessment and evaluation are the two different things. What is the basic difference of that? Assessment describes the measurement of the learning outcome, while evaluation describes the measurement of the course or program outcome. As you are in the program of the IQC, I should not use the word this course. Course, we know that according to NAC, the nomenclature of the courses, anatomy, physiology are the courses, and MBBS the program. So the evaluation describes the measurement of the program outcome, while the assessment is of a single student. So purpose of assessment to increase quality, while the purpose of the evaluation is to judge the quality. Very important. Again, I am repeating, purpose of the assessment is to increase the quality, while purpose of the evaluation to judge the quality. These are the differences between assessment. So assessment is ongoing process, while evaluation provides closure of the observation. Assessment improves the quality of the learner, while evaluation judges the quality of the learner. Assessment is individualized approach, very important, and applied again. Evaluation is applied against the standards. Assessment does not mean grade, while evaluation is give the grade. Assessment provides feedback. Evaluation provides shortfalls on which thing we have to work. While assessment is completely process oriented, while evaluation is the product oriented. Assessment, it is the means, while evaluation is the end. So these are the differences between the assessment. I will give one example so that the concept will get clear. So this IQAC, St. George's University has organized this conference. So you are going to assess my session. So that is the assessment. And you are going to evaluate whole IQAC 2 days conference. So this is the difference between the assessment and evaluation. I think you might have got with this example the difference between the assessment and the evaluation. So what are the types of assessment? You all know two types of the assessment. Formative assessment, it's for assessment for learning, and assessment as learning. The purpose is the learning progression and the improvement is the formative assessment. And you all know all the faculties. Now the medical faculties is the competency based. Ayurveda also made competency based. Homeopathy is also made competency based. And nursing and physiotherapy is already competency based in many universities. So, and the key or the heart of the assessment in the competency based curriculum is the formative assessment. So day to day, we have to give the feedback to the student, and the aim is only to improve. While the summative assessment, you all know, is the final or the end assessment done by the university, and we give that the student has failed or passed. So these are the mainly two types of the assessment: formative and the assessment, summative assessment. Formative assessment is the day to day, and it based on a feedback, and the purpose is the improvement of knowledge, skill, and attitude. While the summative assessment is the at the end university takes that examination is known as the summative assessment examination, and here the students' overall performance is done and the grade is given as pass or fail. There is one quote related to the formative assessment and summative assessment, that when the cook tastes the soup, that's the formative assessment. So, and when the guest tastes the soup, that's the summative assessment. That is by Robert Stakes. So, if there is anything like salt and all this is not up to mark, so cook can adjust it and improve it. But when guest take that soup, there is no or he has to take it whatever it has been made. So very nice quote. I like every day this quote. I in my every session I put this quote. So purpose of the assessment by all and cut is the assessment for learning. assessment as learning and assessment of learning. You all are familiar with the Miller's pyramid, and this pyramid is very useful. It gives idea what you want to assess and what are the assessment tools you are going to use to assess the student. For example, if you want to know notes, simple, then you test the knowledge by the written examination. If you want to know analytical test, knows how, then tested by the clinical problem solving. You all are familiar with this. Shows how is the practical base. So it is by OSCE or standardized patient or clinically. And does means is the expert in that daily patient care assessed by the direct observation in clinical setting. So it goes from up to cognition, that is the our cognitive domain, up to the affective. It depends upon what competency you want to assess. What are your SLS? And according to that, you have to choose the proper assessment method. A very good work done by the Millers, and this pyramid is used or very like a Gita for us. Utility of the assessment. This formula is suggested by Van Welton, and it consists of the 5 assessment principles, that is validity, reliability, educational impact, cost effectiveness, and the acceptability. So what is validity? Validity is the ability of the assessment instrument to test what is supposed to test. So it's very important what tool you are using to assess that competency. So also ask what is the learning outcome to be measured, and use appropriate instrument for the knowledge, skill, and attitude. Reliability is what? That with that whatever the tool you are using or this, the consistency is there. This refers that the reproducibility of the result, and a good instrument should give the same measurement of the same performance on different occasions. That is the reliability. Then educational impact, which indicate the assessment's effect on the learning process. Acceptability, which indicate whether that assessment should be accepted by both stakeholders, that is the teachers as well as the students. So that tool must get accepted by the teachers as well as the students. You know that previously, as I am from medical field, before this competency-based medical education, this OSCE, OSPE, these words are very new to us, and were not taking examination from the OSCE or OSPE. But as from 2019, this competency-based curriculum has come, and each department is now very routinely using this OSCE and OSPE. So now it is the acceptable. Previously, 5 years back, it was not acceptable, but are now like this. COVID has given this all these online platforms. Before that, I think no one has rarely used the Zoom, Microsoft, this one, Google Team, and all this. But now we routinely use this. Like so, now it's acceptable to all of us. Cost of feasibility is also whatever tool you are using, that should be the cost effective. Then also see whether the time involved in developing, investigating, scoring, interpreting, and reporting a test is justified. So these are the 5 utility of the assessment, that is the validity, reliability, educational impact, and cost effectiveness and acceptability. So with this 5 assessment principle, the assessment should be done, and you should keep these 5 principles in mind when you are using any assessment tool. We already, but then as I already told that I joined here in 2022, and here we have very esteemed leader, our Honorable Vice Chancellor, Lieutenant General Dr. Madhuri Kanitkar Madam. She has awarded by all the Param Vishishta Medal, and under her leadership, I am working And we have taken many initiatives in the examination reform. Most important is the blueprinting, second is the on-screen assessment, and the third are the faculty development workshops. Before our university having 25 years history, but there were no guidelines regarding the paper setting. So, and the weightage, for what topic, what weightage is given. And under the madam's guidance, we have started the work to develop the blueprints of each faculty. So what is the need of this blueprinting? This diagram, you can see, it can explain that from the students, we expect too much. As a teacher, we teach very small. And from that, very tiny things are assessed. You know, if there are 10 topics, if you see the question paper, only maximum 5 topics has covered. And remaining topics, no question is there. So that is the reality of the assessment. And then for this, what is the solution? Solution is the blueprint. So what is blueprinting? It's a detailed plan of the action. It is the reference framework for the question paper setter, helps to follow norms and guidelines. So what is the need of the blueprinting? I already told, it gives the transparency to students, to paper setter, to paper moderator, paper assessor. So it's for the transparency. The match various competencies with course content and appropriate assessment tool. Also, possibility of the hidden curriculum greatly reduced by the blueprinting and reduce it to major validity threats, that is the construct under-representation and construct irrelevance variance. So these are the points which cover the need of blueprints. So how this weightage to each subject is calculated is the scientific method. It's different for the clinical subject and different for the pre and paraclinical subject. So weightage is calculated by the formula I into F. W stands for weightage, I stands for impact or perceived importance, and F stands for frequency of occurrence of disease in the community. For the clinical subject, the formula is the I, non-urgent or little prevention potential, weightage given 1, serious but not life-threatening, weightage is given 2, life-threatening emergency, weightage given 3, frequency, that is the F, rarely seen 1, relatively common 2, and very common 3. For example, malaria, we will take the malaria. So, the impact, I think, serious but not life-threatening, that 2 for this I, and the frequency of occurrence, very common 3. Then the weightage will come 3 into 2, that the 6. So, thus, we calculate the weightage. So, weightage formula W is equal to I into F. So, for malaria, we have that I is 2 and F is 3. 3 into 2 is the 6. Then for the basic sciences, the topic have no or little clinical application, 1 weightage. Topic have moderate clinical application, 2 weightage. And the topic have high clinical application, 3 weightage. So like this, for pre or paraclinical, we give the weightage. So these are the 2 books under our able leadership. Our Honorable Vice Chancellor Madam, we have released 2 books, one of blueprints of the CBME MBBS curriculum and another blueprints of the Bachelor of Dental Surgery curriculum, and both are appreciated by National Medical Commission as well as Dental Council of India. And we have already sent the copy of these to all the university. I think your university must have also get. If not, I will send the copies of these 2 blueprints to Honorable Vice Chancellor of your university. Then second, our university is the on-screen assessment. We have done the pilot study of the BDS examination. Exam started on the 14th December after theory completion, then practicals, and practicals were completed on 25th, and coincidentally it was the 26th January, that is our Independence Day, and on that day we declared the result within one day. That was the very I will remember in my life that day, and it was Ganesh Jayanti day, and our team was working at 1 a.m. and at 1 a.m. we have declared the result, first result of the history of the MUHS of the on-screen assessment. After that, we have conducted the 4 program examination on-screen and declare result 2 days. Now also our summer examination is going on, and every day around 88,000 answer sheets are being scanned, and around 20,000 answer sheets are being assessed on screen by all the faculty all over the Maharashtra. So we have also taken feedback, and a very good feedback we have from the assessors, that they are saying that it's very good method. They don't have to do the any sum. Also, if there one marks any, another gives marks. That also take care of the computer takes care. Also, it's a very user-friendly software is there, so it is well accepted by all the teachers. So, what are the advantage of the on-screen assessment? I already told that the result will be declared within 8 days. Because it's the state level university, we have to send. It started from a very rural area, Gadchiroli, Nakshal area is there. From there up to the Mumbai, but our vehicles go. That we distribute the answer sheet. Again, our vehicles go there, take the answer sheet. Then here, bundling go there. Again, we have to send to all the CAP center. All these things has been now stopped with this on-screen assessment. And you know, when there is less human interference, the other malpractices also, there is no scope to occur any malpractices. So auto generation of the database of the marks and marks code, readily scanned images will be given to the student for their retotaling and verification. That is advantage to the student, and the no scrapping of all the answer book, and we need not to bring all the answer sheet of 1 lakh students here. So at college level, after we keep as per our ordinance 6 months, and after that we do the pulping. So all these things have been reduced by the on-screen assessment. And the third our initiative that the faculty develop, that we have our teaching training center. Here we give arranges various courses like our BCME, then the health science technology, as well as blueprint workshops, as well as MCQ, how the case-based, scenario-based, resident as a teacher, various workshop has been organized. These are the, when the teachers get well oriented, as well as they get their concept clear, then their output becomes more. So on this we are working, and with this initiative, it is helpful to all the stakeholders, that is for the management, to the university people, for the teachers, as well as the students. Last but important slide, that the CBME we talk. Now this is the reality I am speaking. This slide is the reality. We talk or more focus on skills. However, you know that the certified skills will be assessed as a part of the continuous assessment and documented in only the logbook. But at the end, only 10 marks will be given to the assessment. Therefore, this seems to be no or little alignment assessment with the objective. It should be there, but it is on paper, but it's not happening. So we have to think on it. And as I said, for that, blueprinting is very helpful. Also, the heart of the CBM is the formative assessment. But you all know, each medical college, dental college, all teachers, that the staff is not sufficient. If you want to conduct or give, the small group teaching, as well as it's very difficult to give the feedback to each and every student. So that's the another thing. In medical college, batches are of 250 students. In some colleges, already shortage of the staff, and giving continuous staff, as I already told, is very critical task. It's now high time we change the narrative as assessment drives learning. It's the time to go back our ancient that is wisdom of the Gurukuls, where the assessment was a part of everyday learning. So again, I already told in many my sessions, I tell that we now say big words, English word, that the cognitive domain, affective domain, then our psychomotor domain. But in our ancient literature, it has already given that. So cognitive domain is the Jnana mark, then psychomotor domain is the karma mark, and affective domain is the bhakti mark. So all these are in us, but as we know that 150 years in, English peoples were ruled us. That's why we are very fond of to take the words from them. But all these things are with us, and again, real time to go for the Gurukul system. So I always express my heart, my gratitude to our Honorable Vice Chancellor, Lieutenant General Madhuri Kanitkar Madam, Param Visishta Seva Medal, Ati Visishta Seva Medal, Visishta Seva Medal. With her, without her support, I can't do anything. She has trusted on me, and I always feel proud to work under her. That's why all these initiatives, all these reforms has been happened. I'm also thankful to all the teachers of the affiliated MHS 600 colleges with their support, with their cooperation. Whatever we are doing is not possible. And I'm also thankful to and I'm proud of my examination department. Whatever the initiative comes, they also, sir, we'll do that. And that's the spirit. And with their support, our teamwork is there. That's why we do it. Our Honorable VC Madam always say, don't use the word I. It's the we. It's the teamwork. So again, I'm very thankful to all the organizer, my former colleague, Dr. Ridham ma'am, give me the opportunity to speak, to take a session on this assessment topic. Thank you very much. Thank you.